Hello, Manong George here. Welcome to our channel, and today we have a very special guest.
I'm Justine Vergara, and I'm currently working as a cath lab nurse here in the United Kingdom.
Manong knows best.
Initially, before I came to the UK, sa general wards talaga ako nagtatrabaho. Although we have experiences na we are taking care of post-cath lab patients as well, at saka preparing yung mga cath lab patients before they go to the cath lab itself. So before coming to the UK, nagkaroon na ako ng small idea on what the cath lab does and what are the things we have to look out for after the procedures as well.
Manong knows best.
Ang cath lab nurse primarily is tumutulong sa doctors to do the procedures called coronary angiogram or coronary angioplasty. Some other cath labs, they also perform advanced procedures like TAVIs or valve insertions. But mainly, the cath lab nurse's role is to assist the doctors in performing the coronary angiograms and to make sure that we have the equipment and knowledge that we would need to take care of the patients pre and post procedures.
Manong knows best.
So for our cath lab, kasi hindi kami 24-hour cath lab, so we start our day off at about 7:30 or 8 in the morning. We set the recovery area up, we set some things up, and then once everyone else is in by 8 in the morning, we have a short group meeting or group huddle to discuss what the plan is for today. Then everyone goes and checks their patient allocations and then coordinates with the other members of the staff. So yung mga radiologists natin, mga cardiac physiologists, and the consultants, of course, kung which patient they want to go up first and if everyone else is ready. And then from there on, we do the cases for the day. We're also on standby for the whole day for emergency cases. So we cater for emergency cases then. And then we hand over the patients back to the wards after their procedure, then make sure that they're stable enough to go home once they're elective patients. And syempre pag inpatient naman sila, we make sure na we coordinate with everyone else. And then once the list is done for the day, wala na electives, we're on standby usually until 7 in the evening para kung in case magkaroon ng emergency cases at kaya namin sila i-cater. So that's how my day usually goes.
Manong knows best.
Main pros is that I have shortened hours. So unlike the usual 12-hour shifts that I do in a day, I usually just go to work for about 9.5 per day. So I get more time to spend for myself when I get home. Mas may time ako mag-prepare for the next day. Ang cons lang for me is that I go to work a lot more because instead of going about 3 days a week, I usually go to work 4 days a week. And then yun nga, wala kami masyadong enhancement since dun sa lab na nagwo-work ako is hindi naman kami 24 hours. And we only do Sundays every now and then. Regarding dun sa lead gowns naman, initially when you start wearing it, maninibago ka talaga kasi mabigat talaga siya. So, regarding the X-ray gowns naman, actually may iba-ibang sizes siya. So, it's not a one size fits all naman. So, ako personally, I usually wear about yung medium sizes lang na lead gown so that I don't give my back too much stress then kasi yun nga, you're usually wearing lead gowns for most of the time in the day. So, syempre, aside from taking care of the patients, you also have to take care of yourself.
Manong knows best.
Yeah, I'm personally happy with the decision I made to transfer to the cath lab kasi aside from having a good team in our cath lab, I ventured out of my comfort zone. So I ventured out dun sa lugar kung saan ako sanay when I started my nursing career. And of course, learning is a lifelong process, sabi nga nila, di ba? So it doesn't mean that I'm in a cath lab now that I still just focus wholly on the cath lab. So I still do extra shifts every now and then naman. So I can still maintain my clinical skills. But overall, I'm very happy with the decision because it's a new part of my career. It's something I look forward to developing and mastering as well.
Manong knows best.
Main advice if you're planning to apply sa cath lab, especially if wala kang previous experience, is that you would need to get a bit more of a background in regards to cardiology in general. So it doesn't mean that you have to master everything about cardiology, but get the main gist of the things you would need to look out for when you're looking for or taking care of patients na with cardiac problems. So mainly learning the simple ECGs, making sure that the patients that you're taking care of, they take their cardiac medications on time, and of course, having an idea as well of what to look after patients who has undergone angioplasty, like complications in sa TR band or anything else that they might need to look out for. So it's mainly just the background because you get the training itself when you're in the job and you learn more as you do the things day by day, kumbaga.
Always remember, Manong knows.
Manong knows best. Put your worries to rest. Wednesday